Hello, 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 and welcome to Spilt Milk, the Food Trust Podcast. I'm your host, Raina Andrews. Spilt Milk is a weekly podcast powered by the Healthy Food Movement. This podcast is focused on our global food system, where we talk about food politics, food justice, and food as medicine. As a mother, a health enthusiast, an author, and a food literacy coach, I've spent a lot of time just trying to make sense of our food system to figure out, should I eat this or should I eat that? And what is even real food? And so I want you to tune in every Friday at 4 o'clock Central Standard Time as we bring in the guests that help us demystify it all so that you can make the appropriate decisions for you and your family. So on today's show, we're talking about National Women and Girls HIV Awareness Day. And who better than to lead this conversation with us is Erica Sinclair, who is the founder of Health Connections Incorporated. And so this month is National Nutrition Month. It's National Women's Month. It's National Women and Girls HIV Awareness Month. And we had the recognition of the day on March 10th. And every year on March 10th and throughout the month of March, local, state, federal, and national organizations come together to really shed light on awareness and prevention necessities for women and girls. On this episode, we're talking about women and child health, specifically HIV/AIDS awareness. We'll talk about the severity, implications, technicalities, and how we can each own our own health. And so, welcome, Erica. Thank you for joining us.
Oh, thank you for having me.
Absolutely. I really want to get into this special brunch that we talked about earlier this week that's happening tomorrow. But I really want our audience to understand and get the depth and reach of who you are as a leader. You know, you being a woman, a female, an African American female that has her own health and wellness firm, which I call a health clinic, but you're so much more, so not to minimize it. Can you just share a little bit about Health Connections Inc. and what it is that you do and how you make a difference in the community?
Sure. Thank you so much for teeing it up for me. So, Erica Sinclair, I am definitely the founder and owner of Health Connections Incorporated. I have a background in African American studies, clinical laboratory sciences, microbiology, and international public health. So, when I decided to start the clinic, the healthcare administration component came from my experience working at Centers for Disease Control in my global health, global AIDS program. We set up HIV clinics in different countries, and then also came back to Milwaukee and managed the HIV clinic for the city of Milwaukee. Worked at Aurora Healthcare as a clinical manager, and also a local fully qualified health center. So when I had the opportunity to start my own clinic, my goal was always to fill the gaps in access to healthcare and also establishing health equity in a very real to-do kind of way. And some of my colleagues say I'm a doer more than a talker. So when I saw the opportunity to actually do something about these gaps in services, I did.
Yes. So earlier this week, I had an opportunity to meet a couple of your team members and some advocates of Health Connections. And can you just talk about more? And I'll just edify up front that the people who know you, Eric and Sinclair extraordinaire, and who have experienced Health Connections, it's like night and day from what they've experienced at other primary care organizations. And I think what one of your clients mentioned is that you see them, you care for them, and it's like you won't let anyone fall through the cracks. And navigating healthcare, that can easily happen. Can you talk about maybe
Absolutely.
your model and the difference at Health Connections?
Absolutely. So, as I had mentioned earlier, having worked in all these different systems in a management standpoint, I knew that they where the gaps were and how and if somebody would interpret a client would interpret one message this way and it was intended that way. So there's a business of medicine, and there's always also the practice of medicine, but it's also how people experience medicine. So looking at how all those things, there's disconnects all through there. And so as we try to help people navigate it, we actually train them on how to use the system the way it's intended. A lot of people have health insurance. Even people have good health insurance, if you will, Cadillac version of health insurance. But I can about tell you that a lot of people don't know how to use it.
Yeah.
A lot of people don't know how to use their health care. They don't. If something comes up, they're like, "Who do I call?" And it's like, "Call your doctor." You're like, "Well, who's that?" I'm like, wait, you don't have a healthcare provider you talk to on a regular basis? And they're like, no, I don't. And so with that being the case, it's like, okay, well, let's start from square one. So it's not really attached to a socioeconomic status or race or ethnicity or anything like that. It's just something that's not taught to people. And if you're not taught, then you just make it up as you go. And so
Mm-hmm.
Health Connections was created to help people navigate the healthcare system in the way that they need it to. And that needs to be customized because everybody doesn't need all the things. And some people, the things confuse them. So
Right.
we help to work with them to navigate, and we do. We definitely see people. Our areas of focus are primary care, HIV, and transgender health. And so, with that being such a wide range of services that we offer, with transgender health as an example, um, when people present themselves, we ask them, "What's your preferred name? What's your legal name?" Because if that's what your insurance is, and we have to know that for to bill. But other than that, what's your preferred name? And literally we call them by that name so often that I forget I forget the other name. I'm like, I don't even know if I know the other name anymore
Mm-hmm.
because I see you as you see you. And
Yes.
to me that's how you give respectful and dignified care. And so we're all about that. So when we have new people come through and get become part of our team,
Mm-hmm.
that's definitely a part that I indoctrinate people about. You have to give care in a very customer friendly way, but you have to be very serious about being authentic
Mm-hmm.
and be able to see people the way they see themselves. And I have definitely dismissed people who just couldn't handle it. They just couldn't handle it. They just couldn't change their ways. They're like, I'm looking at someone that looks like a man. And I'm like, but that's not who they are. You're looking at the outside. You're not looking at the inside. I need you to understand that. So I think
Yeah.
that's why people probably understand how I do care differently. It's
Absolutely.
something that you more feel, and it's more of a feel thing and instinctual kind of way of doing healthcare, and it's not based on what you see. It's based on what you feel.
Absolutely. I mean, that's taking inclusion and sensitivity to a whole nother level. It's like you can't teach that, right? How you naturally empathize and relate and connect to other people. Um,
Exactly.
we're here to talk about National Women and Girls HIV Awareness Day, and we're celebrating the month. But why do we need to focus on women and girls? I think some of our viewers may be thinking it's like women and girls are probably the least likely to contract HIV. So why do we even have a day for women and girls?
Well, that's part of the reason, right there. Um, I will say this: women take care of everyone, and we take care of everyone. If you and there's sayings and there's even research that says if you take care of the children, that the women in the village and the girls, then everyone wins, everyone survives, everyone thrives, and I truly believe that. When it comes to HIV, I've been doing HIV work in prevention as well as actual care and treatment for 25 plus years at this point. And whenever we work with women, they're harder as clients because they're always taking care of everyone else. So when
Mm-hmm.
it comes to them taking care of themselves and their HIV or condition and anything else that's going on with them, they will change an appointment. They will cancel the appointment. They reschedule the appointment because they have to take someone to the doctor, somebody else to the doctor, somebody else to this, that, and the other. And they take care of everyone else and don't take care of themselves. So this is an opportunity for women to focus on women. And March was definitely the natural month for it to happen in, considering it's Women's History Month. And it's just something that we just remind each other, remind ourselves to relax, understand that we need to take a moment and take care of
Yes.
ourselves because if we go down, everybody goes down. I really feel that way. And women should be in every room that there's a decision that needs to be made because we deal in the gray, and the
Mm-hmm.
gray is where the details live. And if you get the details right, then everybody wins.
You are spot on in everything that you say. I want to highlight specifically with women. It's almost as if we're empaths, where we take on everybody else's
Mm-hmm.
burdens and responsibilities,
Absolutely.
and we carry it on our backs like little Doras the Explorers, right? But
Exactly.
you're right. We don't look out for ourselves, and that could be really jeopardizing, compromising to our health. Can you share
Hmm.
some of the numbers of the prevalence of women contracting HIV, or some of our trans women sisters?
Absolutely. So I actually don't have any exact numbers in front of me at this moment. I thought I had my sheet and it went down on me. So, but I will say that it's a significant number of transgender women that are HIV positive. Out of the number of people that are positive, and because they don't necessarily seek healthcare in general, because the healthcare system is not necessarily set up to provide them care with dignity. A lot of them just check out of healthcare. So, with that being the case, they end up coming to us oftentimes with a very advanced version of their HIV. They've had HIV, and they may have had HIV and they knew they had it, but didn't really prioritize getting care for it. So when by the time they get to us at Health Connections, we have to get them back, back on track. And we do that with a lot of patients, a lot of education, a lot of asking them about what else do they need. Because if you don't have, if homelessness is in front of you, then it's harder for us to even get you to focus in on taking a pill every day,
Right. You're
let
trying to
alone
figure out where you're
coming
going to
to
sleep
us.
tonight. Right.
Yeah, where are you gonna sleep? Like, what are we gonna do for food? Like, so we ask them all those questions, and if we can't give it to them ourselves, and sometimes we've gone in our own pockets to say, hey, we this person needs a place to stay for next couple of days. Let's figure it out. We'll pull out, collect money and just make it happen. We've taken, blown up the beds to people's homes, and bedding and things like that. Like, we just can't let people just not not live in a way that is dignified, but also if we get to be a bridge for them into our community partners that we work with, them to the next level and something more stable, then that's just what we do, and that's just how we roll. But there's a risk in with women that is really high as far as making sure that they get their own care take for HIV. That is not the same for other parts of the population that need this care. It's just a really high percentage,
Does it
and about
affect
50% are black women. So out of the people that are positive that are female, about 52% are black women
out of the entire population?
out of population. Yep.
That's alarming, and it's very. Why do you think that is? Is it just because
Again,
we're taking on everything and we're not getting checked? Or is it also because of risky behavior? Or.
yeah, and some of that is survival behavior. A lot of it is survival behavior. So, um, some of it is exchanging sex for, housing, of course, for money. Sometimes you get trafficked and you don't have any control over what happens to you, period. There's ways to, just we just end up being in places, in situations. Sometimes we just trust. Like, it's not always socioeconomic like that. We just trust people, and they say, I'm good, and we don't have those hard, honest conversations with
Well, let
people.
me see your results.
Yes, I
That's.
need papers. Like you had mentioned the other day, it's like, well, let's go have let's meet up at the doctor's office. Let's go ahead and do this test together, and let's talk about the test results together. I
Yeah.
actually used to do couples counseling testing, in where we would have couples test at the same time
Yeah.
and be able to reveal, and I would just be the facilitator about them revealing their results to each other. And it took a lot of time, it took a lot of honesty, and there were relationships that have had grown deeper because they had that experience together.
Yeah.
So that's very serious, especially the ones where somebody was positive and the other
Right.
person was negative, and those conversations, man,
Right.
but they're necessary. And I was proud of them for starting off their relationship with that conversation.
Absolutely, because when you think about, particularly in the African American community, where you say these are the highest rates, in
Hmm.
our culture, it's so taboo to talk about sex to begin with. Although we over sensationalize it in hip hop and culture and on television, however, to
Exactly.
talk about it in the household, you can't talk to your parents about sex. And I
No.
think because of that thinking, it's like, well, if I can't talk to you about and you can't say that you just don't know what you don't know. But I think a part of it is that
Yep.
it's like you need to have the conversation, but how
Hmm.
can we normalize the importance of having that conversation? Because as a female, telling my prospective partners, like, yeah, I trust you and I need to see your results, is a conversation that doesn't happen all too normal. So could you
Right.
share just like a line or two of, or just
Mhm.
some tips for our audience to know that let's normalize this right now. It's like if you want to get to know me intimately, you first need to stimulate my mind. We first need to, get over a couple preliminary questions
Yeah.
before I really give to you. You know what I mean? Lay down with you. And
Yeah.
so, what are some things that you tell your clients?
Yep. We definitely say you definitely have to have these conversations up front in the beginning. It'll make everything else better. Just not knowing, but yet still having sex. Even if you have protected sex, sometimes it starts off protected, and then stuff starts happening and gets quote unquote good, and next thing you know, there's no condom. You're like, wait, we started with a condom, now there's no condom. Yep, no, there's not a condom. And I'm like, wait, so I know you need to come and see me, right? And they're like, yep, we need to come see you. So
Yes.
that's when my clients call me. They're like, and that's the kind of relationship we have. Like, Miss Erica, I need to come see you. I'm like, all right, I already know what's going on. But it really is a conversation where it's like, if you want us, if we want to get intimate, then we have to have these tests done. Like, it's too serious. It's
Yeah.
too serious out here. And if you really care about me, you will not have a problem having this test done and having it with me and showing me the paperwork. So if we go together, it's just quite efficient. Let's just go together.
It's
Let's
quite
get this
efficient, right?
quite efficient. Let's get this done so we can make plans and do whatever we're gonna do. But I mean, you can mess around if you want to, but we can't do anything until I see some paperwork.
So for some of my younger audience members who may be passing by my page and who are very impressionable, I know when engaging in sex, you can definitely be pressured into some things where it's like, oh, come on, it's okay. Well, let's just try it. Let's just try it. Oh, I'm clean. I'm safe. And what it makes me think of is just understanding how compromising you're putting yourself in by saying
Mhm.
okay to that.
Yeah,
Um, let's
it's
talk
a nice
about
thing.
the National Women and Girls HIV Awareness Day. Why is
Hmm.
the girls in that? And what's considered a girl?
Right. I would say legally anybody under 18, but I think the girls, I do know the girls was added because um, our young people are having sex at a younger and younger age these days. And we need them to know that they're a part of this conversation. They need to be a part of this conversation because what they do at any age, whenever they start having sex, is going to impact them for their lifetime. For their lifetime. You can have a baby, you can get impregnated the first time.
Yeah,
That's a real thing.
yeah.
You can get an STI and get one and not know why or how they knew how you got it, but you should not, you wouldn't know that you have it, and you can have long term implications. You can be infertile for the rest of your life. You can have a disease that doesn't go away. It'll stay in your system. You can live
Mm,
with it, but it'll be in your system necessarily. There's just so many things, and then that can just affect other organs and other parts of your body. Like there's some really serious implications, and that's not even counting. And it's in addition to the chance that you can get HIV, which then you will be living with that disease for the rest of your life. And you can live with it and you can thrive, but in my mind, why would you add that to your list of things you have to deal with
no.
unnecessarily? We have condoms here that are available for free.
In your
They're on the
candy dish?
counter in my candy dish. And people get twisted. They're like, wait, I mean, I'm telling you, delivery people come through and eventually over time they figure out what it is and they kind of sneak it. And I'm like, no, let's be very clear. We're open around here. Do you need a bag? I
Yeah,
will give you a bag. You could take more than just those two you just took. But
yeah,
it doesn't I don't have a problem with that. You don't have to be a client of ours.
yeah.
Just come get your condoms. It's a packet of condoms too. It's not just one. It's a
Mm-hmm.
packet of condoms, and that's through a partnership we have with Diverse and Resilient, another
Mm-hmm.
awesome community partner. They supply us with condoms, and we give them out everywhere we go, like candy. As part of our normalizing it, like it's there. I mean, you need it, use it.
That's why I
Instructions
thought
and all.
it was so important to bring you on and to really highlight this conversation to normalize it, because I think when we don't talk about it, you don't know that there's something you could do about it. If your partner is positive, one, you need to have that conversation, but two, to better understand how to protect yourself if you decide to still be in that relationship. And
Hmm.
so I just want to talk briefly about how do we normalize that conversation as a community?
Yeah, as a community, we definitely need to have more open forums and having conversations around it. And I mean places and spaces where maybe HIV is not the only conversation. We should just like maybe it's heart disease, maybe it's asthma, maybe it's other conditions that people are talking about, and that we also bring HIV into the conversation. And I would say that because HIV has now, thanks to the incredible advancements in medicine and pharmaceuticals, it's a chronic condition, just like you have asthma, like just like you would have, like I said, heart disease and things like that. It's normalized. It's normalized and it's stabilized, I should say, so that you can take that medication. You can have HIV still circulating in your system, but such at a low level that you can't even transmit it to a partner because your levels of viral load circulating in your body is so small. It's such at a low level that you just can't transmit it, and that's amazing. That's huge. Um, that's that allows people to live with it and live with it. But you got to take that medication every day, but that's okay because people take blood pressure medication every day.
Let's talk about signs, symptoms, and prevention. I think some people who
Mhm.
don't talk about HIV or AIDS and know the difference may look at some movies, kind of like Philadelphia that came out in the 90s with Tom Hanks,
Mhm.
and be looking
Mhm.
in the mirror. It's like, okay, well, I just had sex. Well, I don't look sick. And so I think I'm good.
Right. Well, it doesn't work like that,
Yeah.
unfortunately. It takes a few weeks for the viral load to build up in your system. If you do, it does get transmitted to you. It definitely unprotected sex is one way, and the main way that you can get HIV. Other ways people think of, but the systems have kind of taken care of it is like blood transfusion. So they check the blood before they give it to you for HIV. So you don't necessarily have to worry about that. If someone is bleeding profusely and they happen to be HIV positive, you have open wounds. So it's some very specific things that have to be in place for you to get HIV in that way. But once it's transmitted, things that it's like a loss of appetite. You may it's almost like having pregnancy symptoms where is not holding food down. You're vomiting a lot. You are fevers, so you have like almost flu-like symptoms.
What is that? Is
You
it like your body rejecting it or
it's
responding
your
to these?
body. Yep, as I tell my son, it's like your white blood cells, your army is just like you do for vaccines. Your army is starting to build up a defense against this foreign matter. And so it's trying to like fight it off as much as it can. But once it's entrenched within your blood cells, then it just takes over. And your viral load or the amount of virus that's circulating in your blood is just so high that it gets to a point where, and that's why when you get to take the medication, it allows it to come down. And again, it'll still be there, but it'll be at such a low level that it's considered undetectable. But we know that it's there. So it's ways to understand. And when you have those symptoms, we are really trying to encourage providers, primary care providers. And if you just go to a clinic that like us that just does STI testing, go and get tested and make sure that you get tested and that you know what your test results are as quickly as possible. And if they're positive and you have a provider that doesn't know how to take care of you, then you should reach out to a specialist, which we are specialists in this field of HIV. There's actually specialists that take exams every year to make sure they're on top of all the medications and what kind of advances have been made, and they are the ones that can take care of you and get you make sure you're on track. So you can also, and people think they're cheating on their providers when they do that kind of stuff, and it's like, no, you have a primary care provider in one place and a specialist in another place, and that's okay as long as we talk to each other and we know what's going on with each other. That's called care coordination. So those are the kind of things that we talk to people about so that they don't feel some kind of way about
Right.
seeing more than one provider.
That's
Yes.
great intel for people to understand. What I'm interested in understanding is that there's this miracle drug called PrEP. Maybe I shouldn't call it a miracle drug,
Right,
but
right.
if just it may sound like a silly question, but I'm going to ask it for some of the listeners. So if I'm in a committed relationship, and I know I'm not seeing anybody, and I know my man's not cheating on me, at the beginning of this relationship, we got tested, so we're good, right?
You're good for that moment. Yep.
So
Anything
the
can happen.
and so
Anything can
even
happen.
with people with completely monogamous relationships, the
Mhm.
message is to still get tested every time you have unprotected sex.
Yep. Yep, and it is. You really have to be, and this is usually for people that are dating and not necessarily in a marriage. But even then, if you ever feel like you just need to get tested, it should be really a part of your regular your annual checkup anyway.
Mm-hmm.
Just go ahead and get it checked in on, because the longer the missed opportunity of making sure that you at least got tested. And if you test and you test positive, it's kind of like when you get a mammogram. Getting an annual mammogram is important, because the sooner you actually detect cancer, that you're able to get it taken care of, and the less chance it'll go into other stages. So it's the same, it's principle here. Get HIV test at least once a year, along with the other STIs actually, and so that you just know what your status is, and then we can go ahead and address it right away. It doesn't make sense to not do that. But there's ways for us to, it should just be normalized in the regular part of the care.
Mm-hmm. So, what is the process for getting an HIV test? Like, do I just have to go into the clinic now, or can I do it from home, or how does that work?
Well, they do have home kits, and Vivint Health is actually one of the our community partners that actually manages a program that can do that as well. But if you're doing PrEP, so HIV PrEP, and we'll talk about what specifically PrEP means. So for our program, we have a program we have our partners with, called Mister MISTR.
Mm.
It's kind of cute, and they have a sister too as well, where we have, if someone is interested, they can go online and go to Mister. They can sign up for to get evaluated for being able to use HIV PrEP medication. And what happens is you sign up, they will send you out a kit, and you do the kit at home. This HIV kit, and one that tests your creatinine, which is important to make sure that you can process the medication properly. They'll get your test result. You send it back in. So you do it at home. They'll send it back in, and then they will call you. The provider will call you and say, "Hey, your test results. Talk to you about your test results. And if your HIV test is negative and your creatinine is okay, then they'll go ahead and mail out the medication." So everything happened online, and a lot of that's because of the COVID-19 pandemic. We put everything online so that people can be safe and feel safe about getting what they need to continue to be safe sexually. So that's how that works. So we can do it in person as well at a lab, and it'll be a blood draw, and it takes a couple of days for the test result to come back. If you are positive, they also do what they call a reflex test, where they test to see if you're positive. If you're positive, they also test to see what the volume of HIV circulation is in your blood, and then that will help the provider at your first visit to be able to talk to you about what medications would make sense based on your clinical profile.
If you test positive, do those results automatically go to your partner, or do you have to share that, or how does that go?
Well, you have to share it, because it doesn't automatically go to your partner. The place it does automatically go to is the laboratory has to report it directly to the state lab. So the state lab gets that test result, which is how people get, and then the state lab then transmits it to the local county and city lab. So then, or health departments, and so that's how the health department knows who's positive for reportable communicable diseases. So one being syphilis, another being HIV, and another now being COVID.
Mm-hmm. I can imagine. I really hope that they keep that same energy of that confidentiality and people being able to do it from home. Because I can imagine certain people will not go into a clinic. Certain people won't get tested for it because they don't want anybody knowing their business. They very well could be walking around with it. And
Mm-hmm.
so, what are some assurances we can share with our audience about confidentiality?
Yes, so no one can give your test results out. It's a violation of HIPAA, which for clinical staff, we hold that very seriously. I don't even let people see test results of indefinite. Let people see test results of even their loved ones that come to the clinic and things like that, because I actually can track it in the medical record to see who's been in which record and in what section. And I definitely dismiss based on that. Like, I just discharge people from our clinic, because we can't even have that happening.
Mm-hmm.
Even if we see someone because we work in the community. So when we're in the community, we see people Milwaukee's very small.
Yeah.
So even with that happens, that's why I cross train my staff on doing different activities and functions in the clinic and in the field. Because if you see someone and you're about to service them, you can speak to them and say, hey, we'll, talk to you after work. But then we hand that off to someone else to take care of them. Like that's how far we go with our keeping our confidentiality.
So, specifically today, we're talking about HIV/AIDS, and I think it's important for us to distinguish the when we talk about HIV and when we talk about AIDS. Now, these are interchangeable terms, right?
Yes.
Okay.
Yes. And the word age doesn't really get used that often anymore.
Mm-hmm.
Again, this goes back to when we talk about normalizing HIV. This is a part of the normalization of HIV. It's if you have HIV, you have it. You're going to have it. It's just a matter of, and AIDS always had a connotation of you are so sick that you're near death. And at one point that was true. And it was based really on your CD4 count and how low it was, and if you ever even bounced back from that, and your CD4 count went higher, then once you hit AIDS, you always were labeled as AIDS. So
Mm-hmm.
that just adds to the stigma of having HIV.
Mm.
So over time, and I'm so glad that we evolved in this field to this stage that it's HIV is just HIV. It's
Okay.
not. We don't even talk about AIDS anymore like that. Now, it has lived on in the name of like these awareness days, like HIV/AIDS Awareness Day.
Yeah.
Other than that, we really don't even reference AIDS anymore. We just talk about HIV.
I think that's important. And I know that today we're focusing on HIV/AIDS. However, what I also think is important is that when you go in to ask your doctor after you've had unprotected sex, hey, can you do a pregnancy test? Can you also do an HIV test? That there's a whole gambit of tests that you should also be asking for. Can you talk about that for a moment?
Absolutely. So, um, you having the condom on helps with not transmitting HIV if you happen to be positive, your partner happens to be positive, but it does not protect you from STIs, sexually transmitted infections. And so those you need to get tested for as well. And when someone says, "Hey, I want to get tested for all the things," I'm like, "I need you to name the things." And sometimes they don't know what that is. And to me, that's a learning opportunity for providers. Name the conditions that can happen so that people understand. Gonorrhea and chlamydia, syphilis, um, gonorrhea, chlamydia, syphilis, definitely HIV, definitely. There's so many other reasons that you can actually have the STIs. That phone just threw me off. I'm like, why did it ring? And it just is you have to be. And when someone asks for your test results, when you give your test results, we actually tell people specifically what they've been cleared for. Like you do not have this, you do not have that, as opposed to just saying you're good. Like that's so generic, and you don't know what you really have been cleared of. But you
Right.
should really be in the space of talking about the very specific conditions.
Right. So when you're having conversation with your newer existing sexual partner, and you're like, "Have you been tested?" Like, "Yeah, I don't have HIV. Yeah, I don't have. I'm not pregnant." Like, do you have herpes? Do you have syphilis?
Right.
Do you have gonorrhea? Because those
Right.
STIs, some are uncurable.
Some are incurable. Herpes is one of them. Yes, and others can if you don't get them treated fast enough, you can be infertile. So they can
Wow.
lead to infertility. So you want to make sure that you're getting checked on a regular basis. And
Yes.
it's just important. It's just
Yes.
important.
Well, let's go back to HIV/AIDS. Okay, so there is something we could do about it. Not only being proactive and making sure you get tested so that
Mhm.
you aren't spreading it, but if you do have it, being responsible for it and getting proper treatment, taking your meds. But also, if you are in a relationship with a partner that's been tested and is not positive, then there's a special drug for that.
Yeah, so that's HIV PrEP. So PrEP stands for pre-exposure prophylaxis.
I always
And
get that wrong. Okay.
I just actually slow down when I say it because it's a lot. It's a mouthful. But basically, before you get exposed to HIV, you're taking a medication, which actually is a HIV medication. That when they're doing clinical trials, they found out that people that are in serodiscordant relationships, so one person is negative and the other person is positive, that if the negative person takes just it's one pill. So, and right now there's Truvada and Descovy are the two pills that you take one of those every day. and it builds up. It allows your system to not to reject the HIV if it enters into your system, and it clears it from your body, and you're able to take that PrEP medication once every day. And if your HIV positive partner also takes their medication every day, then the two of you have a great chance of not transmitting HIV or to each other. Now, again, that's for HIV. It does not cover any STIs, so you still have to wear a condom and be safe related to the STIs. But as far as HIV is concerned, it's amazing that there's an actual pill that you can take, men and women. But some people think that only gay men, or for some reason, are the only ones that take this medication, and
Yeah.
that is far from the truth. This medication is made for men and women to take and to be able to take control of their ability to keep themselves safe.
So
Um, we, Go ahead.
for a woman who's sexually active,
Yes.
and I may have this partner, we just broke up, so I'm going back to Troy over here.
Hmm.
Sorry to all the Troys out there. But could
Right.
she be on this PrEP just as a way of protecting herself in general? Or if someone is, I don't want to say a sex worker, but is it encouraged that she at least protect herself in this way in addition to wearing
Absolutely.
condoms?
Absolutely, absolutely. We have people who some of our clients are in that field. Some willingly, some not willingly. But we do meet people where they are, and we're there for them consistently. Probably one of the only consistent parts of their lives sometimes. And we actually do not no judgment zone. So we help them figure out ways to take this medication safely. And again, sometimes that's putting the medication into they put it into a bottle that's like a Tylenol or like
Aspirin.
some other aspirin, some other bottle,
Inconspicuous. Mm-hmm.
inconspicuous way, and then they say that's my vitamin, my daily vitamin, and it's their way of keeping themselves safe, and it's keeping themselves safe from HIV, but also from any ramifications that they might receive if someone found out that they've taken this medication.
Mm-hmm.
So they it works in both ways.
I thank you so much for sharing this information because I think this is helping many people who come across this video. And what it makes me think of next is I need you to talk about just how accessible it is because one barrier may be as well, I can't afford it. I don't know where
Right.
to go. I don't have the $75 copay. And so
Right.
can we talk about the accessibility of getting tested and
Sure.
getting the treatment that you need?
Sure. So the testing and the treatment can be for free, based on your income, and it can also be for very low cost. We just realized the other day, and I mentioned this to you after we did our had our brunch the other day, that the medication is being through the Biden administration. They're encouraging the health insurance companies, regardless of which one you have, that the plans cover HIV PrEP medication completely. So there's no out of cost pocket for you, meaning that your copay may not be applicable, so you may not have to pay any copay. But there's also Gilead. It has a prescription assistance program where we would, if you don't have any insurance, we can definitely get you into this program, and they will take care of the cost of that medication for you. So it's their way of doing their community, doing their community part in keeping people safe.
Mm-hmm.
So it's affordable, and it's a way to get. It's about $2,500 average per month. So it's an expensive medication, but the expense of saving your life, the expense of giving you quality of life, it's worth it.
Right. And don't wait too long to get access to it. And so it sounds like really to control this, it's knowing your status, getting tested often, and
Right.
working on prevention. Um,
Absolutely.
and so I know people are probably like, "Ooh, I like that, Erica Sinclair. How do I get where's Health Connections? How do I get in contact with them?" So why don't we share with them how to get in contact with you and where you're at?
Sure. I'm at 4655 Northport Washington Road, Suite 325 in Glendale, Wisconsin, 53212. We are a tax deductible 501c3 nonprofit. So if anyone wants to give us a donation to help us continue what we're doing, feel free to go to our Facebook page, as well as our website. Our website is Health Connect, HealthConnect, and we have a donate button there. Of course, we also take checks, and and you can also call us at 414-999-1099, and we can connect with you that way as well.
So this would not be the Spilt Milk Food Trust podcast if I did not talk about food. And so I'm curious, what role does nutrition play in helping,
Mhm.
and really helping with support your immune system, especially those who test positive?
Absolutely. So one thing is very interesting that you said you asked this question because nutrition plays a huge role. One thing that tends to happen is I had mentioned earlier is that people lose their appetite and they tend to not eat they eat foods that are not healthy because they're trying to get a taste for something or they're trying to get that back. And in doing so, it just ends up being the least healthiest food possible
Yeah.
is what they end up eating. So we talk about nutrition and we work with people on their nutrition. They start losing a lot of weight. That still happens. So we work with actually a company that gives us Ensure and different brands of it to help with some of the nutritional value to help with the nutrition. We actually have connection with nutritionists and registered dietitians to help create custom plans for nutrition for our clients because people have, of course, we're all individuals, so we have different needs related to health to nutrition. But we definitely do that. Have to make sure that people, with especially with their medication, sometimes their medication does a thing with them on their taste buds and such, and they don't have an appetite for anything. So a lot of working with the professionals to figure out how to ease it into your lifestyle. Sometimes it's juicing, sometimes it's just doing different things that really are going to be helpful to them. So it's important. It's very important.
Absolutely. I would say, like Alex McGreen, eat your greens, eat your dark leafy vegetables, get
Yes.
all your vitamins and minerals.
All of them,
And so,
all of
as
them.
we're talking about food, we were brunching earlier this week. We had some
Yeah.
good. And so
Yes, we
we have an
did.
event coming up tomorrow. It's the For
Yeah.
Her virtual brunch
Mhm.
conference. Do you want to say just a
Yeah.
little bit about that?
Absolutely. So, Health Connections Inc., in honor of National Women and Girls HIV/AIDS Awareness Day, decided to do a virtual brunch, and that is out of respect for what COVID has done to and has presented to a lot of us. So, not wanting to do anything in person because we're not there yet. We're getting there, but we're not there yet. But we also wanted to have that fem energy come together and make sure that we understand that we do need to recognize and take a moment for that 12 to 1 time on tomorrow, Saturday, March 13th, just to spend some time with each other, just to, hang out, learn something that's very important for us as women and girls, and also just to really recognize and honor some of the other women who have come together to focus in on this day with us. And if I can remember everybody's names and their titles, so this is the thing: State Representative Lakeisha Myers,
Mm-hmm.
um, County Supervisor Sequana Taylor, um, the fantastic Vanessa McDowell. Vanessa is actually from Madison. She is the president and a CEO of YWCA. Um, who's else? Oh, Rashida Butler Jackson of
Yes.
RBJ Community Consulting, and the infamous and I would say Shayna Brown, who's our lead here at
Yes.
Health Connections Inc. She is wonderful, wonderful. The fantabulous Elle Halo.
Hey.
She's advocate, everything advocate
Mm-hmm.
for trans, and they have an event March 27th that we're supporting with COVID testing. But they have a Black Trans Visibility March on
Yes.
Saturday, March 27th. So
And
we're
a
working
block party, right?
and a block party. And that's what we're
Yes.
doing our testing. We're doing a COVID test at the block party. Alice's Garden at 3 o'clock. Meet us there or beat us there.
Mm-hmm.
Uh, and so, yep. So we're all a part of the conversation. And of course, the fantabulous Raina Andrews, who is going to be a part of the conversation. And so come and peek in on our conversation because it was a doozy. It was better than I even expected it to be because between Elle and Raina and Shayna and I, like the conversation just sparked. And it was Black Woman's magic all over the place. I'm telling you,
I
it
so
was. You
appreciate the
have to
invitation. I'm
absolutely.
So, if you are interested, you can just hit the link in our bio here on Spilt Milk. You can go to Health Connections Inc. and their Facebook page and sign up for the Eventbrite. Please pre-register, and it's from noon to 1:30 tomorrow. You don't want
Noon
to
to
miss it.
1:30.
And
Noon to
so,
1:30. Yes, and you get a
yes,
gift box, and we have wonderful wellness gift boxes that we're giving out. So for those that are registered, so it's we encourage you to register. We really do.
All right. So hit the link in the bio. So before we end, I know that you are intimately involved with the COVID testing. And so I want to pick your brain about you've really been at the forefront of testing across the city, right? And
Yeah.
so I want to pick your brain about if people have been have gotten the shot, the COVID shot, and they've
Hmm.
gotten their second dose,
Hmm.
do they still need to wear a mask?
They do. They do. So if you was like today, if you imagine to do it today. So today was my second dose day. So I am very, very happy about that. Very relieved to a certain point, but also very still cautious about the fact that one, it takes 2 weeks for me to be fully, you know, vaccinated, if you will, and for it to take a full effect in my body. So it takes 2 weeks. But even then, the fact that there's wearing a mask really helps you protect yourself from others and others from you,
Mm-hmm.
because you can still get COVID even if you get the vaccine. The vaccine is only for and it's huge, but it's for decreasing the severity of illness, decreasing the number of hospitalizations, and decreasing death. But it does not prevent COVID from happening. So testing will always be a part of your of the way to manage COVID. And the other thing is COVID's going to be living with us. We're going to be living with COVID for a long time. So right now, getting the vaccine is just one way and one tool in the box, and it's a very important tool. I encourage people to get it. If you have questions about it, please do call us at 414-999-1099. We will talk to you about it.
Mm-hmm.
And we also are setting up, and I'm also coordinating several community vaccine clinics in Milwaukee, in the greater Milwaukee area. So I will let you all know about that. So if you go to our Facebook page and such, we will be broadcasting that. Our first one is going to be March 26th.
Mm-hmm.
So we'll talk, and then there's another one March 31st.
Mm-hmm.
So we're setting them up and getting everybody vaccinated and access to vaccines. If you're interested in getting one, something set up in your facility, where it was businesses and such, then give us a call. We'll talk about it. We'll
Yes.
talk about it.
So you have a very active social media page, and of course they can go to your website. What is your social media handle?
Oh, it's Health Connection MKE
Health
dot
Connections
and then
MKE.
for Facebook. Yep.
We'll
And I
also.
think we have a Instagram page. We do. I'm not
I think
Instagram
it's Health Connect MKE.
for
I
Instagram.
think so. Yeah.
It is. Yeah, I'm not well versed in that, but thank goodness working with young people because they they know this stuff way better than I do. And I'm like, just put the thing on the thing, and they're like, oh, they know what I'm talking about. And I'm like,
With the
oh,
thing on the
good.
thing, with the thing, girl, you know what I'm talking about. The
You know what I'm
thing.
talking
Yeah.
about.
Well, what this makes me think of is there's so much misinformation about COVID, and people are like, well, I got my shot. Now I can go back to business as usual. Now I'm going to gather with my family and friends. And
Mm-mm.
I read in the paper earlier this week or last week about New York piloting where when you get the vaccination, you'll kind of have like this app on your phone, and that in order to go to big events like at Madison Square Garden, you have to have this pass. Have you heard about that?
I have, and that's only going to lead to other situations like that with travel, with being able to enter buildings. Like it's going to get very sci-fi ish moving forward, and I could see that happening. And I just want us to be not surprised by it when it does happen,
Mm-hmm.
but I do want us to be ready in whatever way that means. I mean, does that mean you don't go to Madison Square Garden anymore? It might,
For some.
or it's very interesting, but and not to feed into any conspiracy theories or anything like that. But I do want people to be informed about things like that. So I'm glad you brought that up.
Mm-hmm. And so even when you get the with this pass and you show that you've gotten your vaccination, you'll still have to wear your mask going into some of these places.
Hmm. Yeah, and depending on what the venues and where they're what's going on with the rules and regulations in those particular areas. So
Mm-hmm.
right now we still have a mandate in certain restaurants and certain spaces and such where and everybody I think is at this point we've been a year into it now, which I can't believe it's been a year, but it's a year later, 530,000 deaths at this point. Just it's amazing. Devastation
530,000 around the
deaths
world or across
around
the.
the across the
U.S.
U.S. The U.S.
Wow.
530,000 deaths. And so, with that being the case, and I had mentioned this before, is that when I thought about the vaccine, I took the vaccine in honor of those people who didn't have a chance to take it. And how who am I to pass up the opportunity to save myself and my community and my friends and family, and can continue to contribute to the community in a positive way. And I had a chance to, to protect myself, and I didn't take it. Nah, not the
Mm,
kid. Like
not the
I can't
kid.
let those people down. I can't. So this
This
is and that's what I thought about when I did think of those 530,000 and counting.
was there ever
Unfortunately,
a point where it's like, no, I'll give my vaccination to somebody else. So then you thought about the role that you play, and I
yeah.
guess who you are in the community. And if you don't take it, then there's some questions there.
There's some questions. There's also some it would be guilt on my part if I got it and gave it to somebody else. And then they didn't make it. It was a lot of emotions around it. One thing I would say, and I've heard from other people, and it wasn't from me, the variants of COVID variances, that there's different strains that are circulating now in Wisconsin and Milwaukee specifically as well. That was a huge motivator for a lot of other people to go ahead and get it. Because again, you have to have some kind of defense. If you don't have anything in your body trying to help you, then you're just at risk. And being at that kind of level of risk, nah, not unnecessarily.
Speaking about being at risk, and this just came up talking about HIV awareness for women, for those who
Hmm.
have compromised immune systems, HIV, or maybe even cancer,
Yes.
um, can they get this vaccination?
They can. So as of March 29th, that's when for Wisconsin, that's when that condition, along with other chronic conditions, have become available, and make allow them to be eligible for the vaccine. So a lot of us as vaccinators, and I'm a Wisconsin DHS vaccinator site myself, but I'm also coordinating with other vaccinators in other spaces to actually hold clinics, to make sure that we are getting that particular service in a dignified manner, one that honors our time. So they're going to be scheduled, and making sure that we have safe or safe setup as far as where we wait, who waits with us, making sure we get our next appointment if that's necessary, things like that. So I'm helping to coordinate those things in the community, churches and community centers,
Mm-hmm.
for that very reason. We want to make sure that we are taking care of each other the right way. So people that have those kind of conditions, they now can come as soon as March 29th.
Mm-hmm. Well, that's great news. As you talk about the vaccination, I know that there's Pfizer, Moderna, and is Johnson now available?
Yes.
Wow. Okay. And so it's
Yep.
important to know for people to know which shot they're getting.
Well, this is the thing. Logistically, we don't always know which one we have in advance,
Okay.
because the allocations come from CDC, and then they are decided upon at the state, for distribution into the vaccinator sites. So all of us as vaccinators, we don't necessarily we put in an order and say, hey, we need 500, and they say, okay, we're going to send
It's
you
not like
500.
give me 200 of
That
Pfizer, give me 300
exactly.
of Moderna.
Exactly. They just send us what they got.
Right.
And so when we get it, that's when we know. So that's a part of us planning. When we plan these clinics, we got to be very careful about when we plan them, because sometimes the timing is not the same either. So
Yeah.
we think, oh, just set it up for Tuesday because we're gonna get our, shipment on Monday, and then it doesn't happen, and we're like, we got these people hanging. So we have ways to make logistically work those things out. But yeah, we don't know what we're gonna get necessarily until we actually get it. But like some of my other colleagues say, the best vaccine for you is the one that is being presented to you at that time.
Mm. I think that's a great point to make because I remember when we were touching on this in January, you talked about there's a difference between your number being called and you qualify, but another
Mhm.
side of it is the availability. And so if you're like,
Exactly.
no, I'm going to pass my vaccination off to somebody else, there's a chance that it's going to be a while before it circles back to you because it's in
Exactly.
such demand. Is that still the case?
Exactly. Yeah, and it's getting better because the supply chain was so horrible in the beginning, and now it's ramped up more. And then now that the Biden administration has given more funding to these places, we even have like I can't remember who it is, Johnson and Johnson, and I forget who the other manufacturer is, but they're even partnering to create more Johnson and Johnson vaccinations. So that's amazing that that's even happening.
Yeah.
Because collaboration is key to this, and they're just using. I think it's Merck, I want to say, but they're expanding their ability. They're actually creating the Johnson and Johnson vaccine, producing, I should say, in addition to Johnson and Johnson to expand the capacity. That's
Wow.
huge. That's
Wow.
huge. So yeah, we're working with each other, and now that it's getting better, it's more available. But as we open up for everybody, it's going to be less. It's going to be harder to find it. But we're all working, and we're growing as vaccinators too. So we're getting
Oh
better at it. We're
my
getting
gosh.
better.
Erica Sinclair, you have your hands in a little bit of everything. So that's why I said in the beginning, Health Connections, that's appropriately named because you certainly help us connect the dots. Not only can you provide primary care and helping people connect the dots, but also, I mean, with COVID testing and HIV awareness and the outreach that you have in Tailored, folks, we've been speaking with Erica Sinclair, founder of Health Connections Inc. Be sure to go to their Facebook page, go to their Instagram page, and sign up for her the
Mm-hmm.
virtual brunch tomorrow from 12 to 1:30 p.m. If for nothing else, sign up, get your gift box, okay? But you really want to tune into the information because this is about prevention. It's about knowing your status, and it's really about stopping the spread of HIV and AIDS, not only for girls and women, which is who we're focused on this
Mm-hmm.
month, but just really for everyone because you don't need to suffer from it. You don't have to contract it. And now there are tools in place to really help you. So, again, thank you, Erica Sinclair, founder of Health Connections. If they want to get in contact with you, what should they call? What should they go to?
Thank you. It's 414-999-1099.
All right, wonderful. You've been listening to Spilt Milk, the Food Trust Podcast. I'm your host, Raina Andrews. Tune in next Friday at 4 p.m. Central Standard Time right here on Facebook. Thank you. Bye-bye.